9 benefits of magnesium.
Magnesium is a vital mineral that our body uses in more than 300 of its chemical processes, including muscle and nervous system function and extracting energy from food. In fact, there are so many more benefits of magnesium, from better sleep to improved mood. Magnesium deficiency can increase your risk of heart disease, type 2 diabetes, and osteoporosis, which makes it important to ensure your intake is high enough to support your body.
Magnesium overdose is possible, so ensure that if you choose to take the best magnesium supplement, you are following the guidelines, and if you have an underlying condition, we advise you speak to your doctor first. Eating more magnesium-rich foods is another way to top up your levels safely. So what are the main benefits of magnesium? 1. It may help sleep. Magnesium regulates neurotransmitters that are related to sleep, and in studies, people who have issues falling asleep who were supplemented with magnesium found it easier to fall asleep. There is also a link between magnesium and restless leg syndrome, with evidence suggesting that magnesium supplementation can help alleviate this, mainly, nighttime issue. 2. Improves mood. Magnesium has been linked with improved mood, as it helps to regulate hormones such as serotonin and melatonin, the feel-good hormone and the sleepy hormone. It is also involved in our stress response. A 2020 study found that chronic stress and anxiety depletes the body's stores of magnesium, which leaves us less equipped to deal with stress. Consuming sufficient amounts of magnesium can help you better handle stress. 3. Can help ease period pain. Magnesium can help to reduce period pain. There are 2 reasons magnesium may reduce period pain. Firstly, magnesium is a calcium antagonist and has been shown to reduce uterine muscular contractions. Secondly, it inhibits the production of the prostaglandin PGF2 alpha. Women with the greatest degree of pain relief when taking magnesium were found to have the lowest amount of PGF2 alpha in their menstrual fluid. 4. Supports bone health. Magnesium can help keep our skeletons healthy. Magnesium is a major component of the bone, and the majority of the body's magnesium is stored in the bone. Consuming a diet rich in magnesium is important, and studies have found that it leads to greater bone mineral density. 5. It's good for cardiovascular health. Sufficient magnesium intake has been linked to a reduction in blood pressure and lowered risk of developing cardiovascular disease. Magnesium supports endothelial function. The endothelium are the cells lining blood vessel walls. Directly and indirectly, it initiates both vasodilation and vasoconstriction, lowers blood pressure, reduces the risk of cardiac arrhythmias, improves insulin resistance, prevents platelet aggregation, and has an antithrombotic effect. It can also improve exercise tolerance in those with stable coronary artery disease. It has been calculated that adding magnesium to drinking water would reduce mortality by 30 to 35%. Low magnesium levels are associated with accelerated atherosclerosis in the coronary arteries. 6. May reduce the risk of type 2 diabetes. Magnesium supplementation can help to improve the glycemic status in pre-diabetic patients. There is growing evidence that magnesium supplementation may reduce your risk of developing type 2 diabetes. Several studies have demonstrated an inverse relationship between the dietary intake of magnesium and the risk of developing type 2 diabetes. Type 2 diabetes has been noted as more common in those with low serum magnesium levels. Although the exact reasons for this are not known, magnesium is a vital cofactor for many of the biochemical reactions involved in carbohydrate metabolism. 7. May help with headaches. Magnesium deficiency can play an integral role in frequency and severity of migraines and headaches. The reasons for this are not well understood, but magnesium deficiency can cause platelet aggregation, which has been observed during migraine attacks. It also disrupts the electrical activity of the brain cortex, causing abnormal cortical spreading. This is a depolarized wave of altered brain activity. The concentration of magnesium is also essential for serotonin receptor function. Low levels of magnesium lead to a reduction in nitric oxide synthesis and affect N-methyl D-aspartate receptors, glutamate receptors, which then cause behavioral changes such as impaired concentration and memory. 8. May help to treat asthma. Asthma is a complex condition and has been linked to magnesium due to the anti-inflammatory effect magnesium can have on the lungs. It causes bronchial dilatation and vasodilatation and is sometimes given intravenously to treat severe or life-threatening asthma.
9. May help with seizures. Due to the intimate relationship between magnesium and nerve function, there is potential for the use of magnesium in treating or reducing the incidence of seizures.